Friday Night Lights are almost back, bringing big crowds and, of course, plenty of excitement. But doctors say there's also a growing concern behind concussions. Mark Gadd heard from experts and shares what they have to say for parents of young athletes.
Packed stands, loud cheers, and bright lights. High school football is gearing up for another year of excitement. But beyond the touchdowns lies a level of concern to one of high school's biggest sports.
A concussion happens when a bump or a blow to the head or even a whiplash injury causes the brain to sort of move around in the skull, and it disrupts the brain function.
The National Institute of Health says football has the highest concussion rate among any high school sport, and experts are throwing a flag on the play.
We think that people who have CTE deposited in their brain are those folks who've literally had hundreds of hits to their head over the course of their sporting lifetime, and during a time where we really didn't think much about concussion other than, hey kiddo, rub some dirt in it, get back in there.
Time is of the essence for the acute concussion. We want to try to get that diagnosis and treatment going as soon as possible.
One step some local high schools are taking, requiring players to wear guardian caps, adding extra padding designed to cut down on head injuries. Dr. Rachel Smetana, a clinical neuropsychologist with UVA Health, says safety often starts with the most simple advice.
I always start with encouraging athletes to follow the rules of the game. We might see people not pay as close attention to the rules or, maybe do an illegal hit or something somewhere.
Common symptoms of concussions include vomiting, sweating, nausea, and slurring of words, but could also lead to a change in personality.
I've seen one athlete before that came off of the field after a particularly big hit, take off his helmet, throw it at the ground, bouncing off the ground, and started yelling and cussing. And that wasn't a sort of quote unquote classic concussion symptom, but the big abrupt emotional change in this kid was the main symptom for him.
And Posa says it's important to not punt the full recovery process.
You're 16 now, you're 17, you're 18, you're 20 now. Just because you've had 3 concussions doesn't mean you will be demented by age 40, but that means we need to be very intentional about how we get you back into sport and what kind of sport you play.
In Charlottesville, Mark Gadd, CBS 19 News.